Do you have a chronic medical condition that requires daily medication so that you're okay, such as thyroid, high blood pressure, heart disease, or mental illness?
One of the concerns that I have is so many of our medications are produced in China and other places. And right now, our relationship with China is not super good, and I don't think it's going the right direction. This concerns me a lot that we have shortages now, and we're going to have even worse shortages if things get tense.
And so, along with our food storage and everything else, storing some backup medication really makes sense. And it's been really challenging to be able to do that depending on how willing your healthcare provider is to write you a prescription for a longer period of time. But we found the solution, and this is brand new. And so we are thrilled to be able to share with you a doctor that will write the prescription, a licensed physician, and a licensed pharmacy, and deliver that medication to your door so that you have a year's supply of your chronic medications.
What a great solution.
Hey, Provident Preppers, I'm Jonathan.
And I'm Kylene, and today we are thrilled because we have Dr. Sean Rowland back with us, who is the creator of Jase Medical. And for those of you who have seen our previous videos, they have something called the Jase case, where you can order antibiotics that are prescribed by a physician and distributed by a licensed pharmacy to have in your emergency preparedness supplies in case you need them. But one of the big problems that we've had in all of this is that antibiotics aren't the only medication that we might need to stockpile, right? If you're on a chronic medication, some of our physicians might be willing to write a longer prescription and other ones definitely aren't. And so Dr. Rowland recognized that there was a great need for this and has been working super hard to be able to come up with a solution. And we're thrilled that today, Dr. Rowland gets to announce that solution. So talk to us about Jase Daily. So there's the Jase case, which is the antibiotics, but Jase Daily is the chronic medications, right?
Right, absolutely. We love our Provident Prepper audience. We love what you guys are doing. We love your mission. And so very excited to be here today to talk more about this. This is something that from day one, really, we had the Jase case, the antibiotics, and it was the first day that was made available to the public. We got those emails saying, hey, thanks so much. How about my blood pressure medication? How about my thyroid medication? Whatever the case may be. So, and maybe just to quickly highlight before kind of getting into that, it's been a little while since we talked last. And I think since that time, all we've seen over the last few months is just these ongoing issues with shortages in medications. Over the winter, we had amoxicillin for children. We had children's Tylenol you couldn't get. We've had Senate hearings just as recently as a couple of months ago, highlighting specifically what's going on in our country when it comes to our access to these vital medications. So I think the timing couldn't be better. What we are announcing today is this Jase Daily service, and that is where we are offering up to a year's supply of medications for your chronic conditions. Those are the medications you take every day for high cholesterol, diabetes, seizure disorders. I mean, the list goes on and on. And, as with our antibiotic service, the Jase case, we are working to balance safety to be medically appropriate. Our physicians have to be comfortable with these requests. And so not every medication is on the list, but we've worked really hard. You mentioned it a few times, how hard we've worked. And it's true. It's been a lot of work. And the reason is because you've got so many more medications. We had 5 antibiotics. We curated those 5 antibiotics, specifically chose them for the coverage that they provide and also their safety profile. And now we've amplified this out to hundreds and hundreds of medications in different dosages, making sure that only those medications that would be appropriate to have a longer term supply on hand were included, and that those that weren't were off the list. So that's the Jase Daily service that we're excited to offer. It's up to a year's supply. of those prescription medications.
That is awesome. I was doing a little bit of research for our interview today, and I looked up how many prescriptions for some of these chronic meds are given out every year. One of them was 114 million, which means that it was for, I'm not sure I can say this, atorvastatin?
Atorvastatin?
That. It says
Yeah.
114 million. And
Just
I thought,
for that one.
just
Wow.
for that one. And I thought that means that there is a super great need out there, right? When we have these challenges and when the shortages come, or for some reason you're not able to get that medication, it's wonderful to be able to have a backup that's going to buy us time until we can do something else. Now, I think one of the things we need to point out here is if they are getting this chronic medication, that means that they need to make sure that they're rotating it really well. You're not going to take this and stash it away. You're going to take the prescription that's oldest and use it first and make sure that you are rotating it appropriately. So you're going to continue to fill it from your regular provider, but you're going to use up the Jase Daily first, and then you just keep replenishing it, right?
Right, exactly.
Are there any limits? So you can prescribe up to a year. Do you put any limits on that? Do they just do it every year, or?
As far as, yes. So you described it well. I think once you get it, it's like, okay, that makes sense, but it's hard to explain it in a way that when you talk about rotating stock. But the idea is once you get that year's supply and you've got that on hand, the idea isn't, hey, you've now got a year's worth of meds. You don't need to talk to your doctor ever again. The idea is you've got your supply now. You need to keep seeing your doctor, get those regular refills, especially if you've got insurance that's going to pay for your regular refills. And then you just get the, whether it's monthly or every 3 months, and you'll use that new prescription, put it at the back end of your supply. And then that way you're maintaining you'll always have indefinitely a fresh year supply of medication. And so the limitations really are more so to do with whether a medication's on the list or not. I think those are just kind of a hard and fast one. We don't deal with any controlled substances. We don't deal with medications that might need more consistent monitoring. One that just comes, kind of a classic one would be warfarin or Coumadin, which is an older medication that people with things like atrial fibrillation, heart-related things, arrhythmias, they might be on that kind of a medication. That requires pretty consistent monitoring, sometimes on a weekly or even, multiple times during the week. And different conditions, if you get sick, if you have other things going on, can change those levels pretty quickly. And so those medications are off the list. Now, there might be some others where there is some monitoring that needs to be involved. Some of that would be maybe like a thyroid medication for people with low thyroid that need to get those thyroid levels checked regularly. And that just depends. You may have been on the same dose for years and you get your thyroid checked regularly and your dose has been stable. The doctor would probably look at that and say, I'm okay with a year's supply. Now, maybe you've changed, in the last 6 months, and they might say, okay, well, let's just give you a 6-month supply. And that gets into part of the service, which is not just, hey, I need to go to a pharmacy and pick up a year's supply of my meds. That's part of it. The pharmacy is a big part of it, but the physician visit itself is also important, where they can look at your history, look at the meds you're taking, see which ones are appropriate, see which ones aren't, and then have that ongoing support afterwards as well. So it's not just the doctor, it's not just the pharmacy, it's this whole service that has been, I guess, packaged to make it as convenient and safe as possible.
Okay, so now let's talk a little bit about cost. All these medications have a different cost. Talk a little bit about cost and about insurance. Can we bill through our insurance? Can we use a health savings plan? How does all of that work?
Yeah, so it's really similar to the Jase case. The insurance companies, typically for the Jase case, they're not going to cover the treatment or the dispensing of medications, maybe for an illness that you don't yet have. Now, it's similar for the Jase Daily in that they're just not built. Now, there are very few exceptions where an insurance company will actually say, okay, we'll pay for this year prescription. It's typically done on a refill basis, where they will pay for a year's worth, but they want you to get refills every 30 days, every 90 days. So really, for all intents and purposes, this isn't covered by insurance. We kind of alluded to that in the rotation schedule, where The initial year supply isn't covered, but of course you'd continue to get your refills, and those would be. Now HSA, FSA, that's different. As long as you typically, and this is where I would encourage everyone to talk to their accountant to make sure that the IRS is going to be happy with how they've classified the use of their HSA or FSA funds. But this should be covered under either of those scenarios. Just again, to touch on cost, this is another reason we talked about the importance for the doctors to be involved, the pharmacies involved. And then again, the other thing that we've worked hard on is we've negotiated pretty aggressively with our pharmacy partners to say, look, here's what we're doing, here's what we're trying to do. We're paying out of pocket. Our patients are paying out of pocket for these things, and they're getting a whole year supply. So we need your best pricing up front, and done our best to pass that along to the patient so that it's something that you can afford. And you think about, 365 days, a whole year supply, that might just be too expensive for me. And what you'll find is you can go to the site, you'll see as you get into the encounter, you can select the medication that you're looking for, and it'll give you a price right there, and it'll tell you this is what your year supply will cost. And you'll see that the cost varies widely. It really just depends on medication by medication. Thyroid medications are typically a little more expensive than a cholesterol medication. And so really, I just encourage everyone to go to the website, start the encounter, and you'll see there where you can put in your different medications and see the price up front before you go through everything and commit to the visit and commit to the whole process.
So if I needed a medication and I'm looking at the price and I think, okay, let's just say one of the medications I looked up this morning, the average cost was $15 a day. I'm looking at that and thinking, okay, and it wasn't from you guys, it was across the board, right? It was some of the research I was doing. If I'm looking at a medication and I say, I can't afford a year, is it possible to get it for 6 months instead, or for 3 months, whatever it is that I could realistically afford?
Yes and no.
Okay, help me.
Yes, because the doctor obviously is able to work with you that way, but the system's not as streamlined in our system that way yet. So if that would be kind of a case by case basis where you would have to work through our customer service to say, okay, I'm out of your kind of normal flow. In my case, my medication is particularly expensive and I can't afford a year's supply, and we could certainly work through that. I think you'll find though, and I think most people will be pleasantly surprised in most cases at how affordable a year's supply of their medication really is. What you said, $15 a day. Gosh, I'm trying to think of a medication that costs that much. That's a really, really high,
Really
and probably
expensive
quite the
medication.
exception.
And I'm sure it was name brand, right? Are you using generics?
Yes, yeah. So
Which makes a huge difference.
Huge difference, and it would be cost prohibitive. Not just cost prohibitive, but in some cases just really hard to get that amount of medication if we were doing brand name medication. So this is 99% of these are generics, and that helps tremendously when we talk about cost.
I am super excited about this. I mean,
Yes.
almost as excited about as when we did the antibiotics, because I've got antibiotics now in my storage, and I'm a person who actually doesn't like to use antibiotics, and I will avoid it unless it's absolutely necessary. But sometimes stuff's going on and it's life or death, right? You really need those antibiotics. And so I'm excited to have those. But now all of our friends out there who have chronic conditions, especially in the comments, thyroid came up over and over and over again. And that was a really big deal. So now there's an option as long as you meet the criteria, which on the beginning of the site, I mean, there's certain things like you couldn't have an active infection that was under treatment, no body ulcers, not on dialysis, no liver cirrhosis, not waiting on an organ transplant list, not undergoing cancer treatment, and not on hospice. That totally makes sense, right? Those kinds of scenarios are going to exclude you from being in what we qualify as good health. But now this medication is available. Financially, it sounds like Dr. Roland and his team has made it so that it's going to be affordable.
Say just that you mentioned some of those requirements. And I think really the thing just to keep in mind is, I guess the goal at the end of the day is we want to make sure that that you're stable. This is a stable condition, that your dose hasn't been changing recently, that your health condition is stable. And that's where a physician says, okay, I'm comfortable with this extended supply. And so there are a few different requirements than you would see on our Jase case, where we want to know that you've seen your doctor maybe a little more recently than we do for the Jase case. And there's a couple of other, we're not diagnosing any new conditions. This is something that you've had, it's been diagnosed, it's stable. That's probably the biggest difference between this encounter that you have with the physician versus our Jase case.
I appreciate that you're practicing responsible medical care, because that is the thing that scares me the most about some of the other stuff that goes on, where you're ordering stuff from different countries and you're doing things on the sly. That's terrifying. And so responsible medical care, I think that gives us the very best outcome. You wanted to say
Yes,
something?
I just wanted to mention how concerned I've been. I didn't realize until I was doing a little bit of research that we do have shortages even here in the United States. That totally shocked and surprised me. My impression of the world situation right now is that our relationship with China is degrading, and will probably degrade a lot if, depending on what happens with Taiwan. And we are so dependent upon China. This makes me extremely nervous, and I'm not sure why we're not making progress towards fixing that, but we don't seem to be making very fast progress. Talk to me about that.
Yeah, I'm really glad you brought that up. It needs to be talked about more. As I've gotten more and more into this, and over the last few years, obviously following it really closely, I remember when I first was just looking into things, and you would hear about, this was maybe a couple of years ago, there was some government, on a governmental level, on a federal level, some attention being paid to this issue with all of our generics being produced overseas. And I was encouraged by that. But then as you look back, you see, well, this has been going on for years. They hold these meetings, they talk about it, and nothing gets done. I referenced at the beginning of this conversation that the most recent, which was a Senate hearing, specifically looking at different parts of our industry that were at very high risk from a national security perspective because of when we talk about our relationship with China. And one of them that they highlighted was the pharmaceutical industry. And so once again, here they were talking about this and saying how problematic this is. But to date, I am not aware of anything that's really been done that's actionable that you can point to say this is going to help us as a country to be more prepared. Look at last year, 2022, we had a new height of drug shortages reported. It was 295. That was a 30% increase from the year before. Now, that's worrisome. What scares me even more is that of those 295 drug shortages that the FDA was aware of and reported, less than half have a known cause, meaning that over half the time, we don't even know why these drugs are in short supply. All we know is that they're not produced here, that in many cases, you can look at the regulations that the FDA holds China to and others, that China's not required to tell the FDA where a lot of their ingredients even are sourced from. So you've got just a lot of uncertainty in this whole entire supply chain. You mentioned Taiwan. Absolutely, the relationship right now, I don't think there's been a worse time in our history between the relationship between China and Taiwan. If or when China invades Taiwan, that's where these medications come from. They come through the Taiwan Strait. And for us to scramble and try and find new sources when our whole system is dependent on this, it's going to cause massive disruption. If we're able to find alternative sources and get all of those supply chains fixed, it would take months and months. And meanwhile, what do you do? So I mentioned how right at the beginning we had requests for what about my daily medications, and it was in the works even before those requests came, because it was obvious that something needed to happen. And I've said this before for antibiotics. I can't just wave a wand and bring production back to the United States. We're working to do what we can in that regard behind the scenes. But right now, what I can do is bring the pharmacies together, bring the doctors together, create this platform so that on an individual level, we can reach out one by one to people and let them know, hey, this is something that you can do to be prepared at home. This is something that I can empower you with, so that you can be in charge of your own healthcare, at least when we're talking about being prepared. And so that's the mission that we're on.
Dr. Rowland, I can't tell you how much I appreciate that. I just really, really appreciate, because it's blessing the lives of so many people, and so many people that we love and we're directly impacted by. For those of you who want to get on this right away, we will leave a link. And if you use the promo code Provident10, you will get $10 off either the Jase case with the antibiotics or with the Jase Daily. But I have one more question before we leave, and I know that insulin is something that you can't do at this point. And we have a few different people who are very precious and dear to us that is a huge concern. Is that maybe going to be a possibility in the future? Tell me a little bit about that.
Yeah, that also brings up. I'll talk about insulin. We said these are generic medications. Right now, they're all oral medications, whether that's a capsule or a tablet. We're working, and it should be really soon here in the next days to weeks, where we will be adding topicals, injectables, other forms of these medications. Now that brings us to insulin. Insulin is one where, again, we're talking about dosages can change, and it's really dynamic, and so we want to be sure that this is someone who understands their condition, understands how to take this medication. Those people are out there. They've been diabetics their entire life, right?
Yeah.
They've been dependent on this insulin their whole life, and lived day to day, hoping and making sure that they have access to their insulin, because it is one of the few on the list that truly is something that if you go with a day or two without, you're in a world of hurt. So yes, we are actively working on a solution there. And it turns out that insulin, if it's stored properly, if it's kept cool and in that proper temperature range, then you can store it for up to a year. And so there are options out there. And then we got to look at costs. Some insulins are really expensive. A lot of the ones we use nowadays are really expensive. But there are other options. Insulin's been around for a long time, and if you look at some of the older formulations, they're harder. They're more inconvenient, I should say, to dose, but they're much more economically accessible. They're a lot cheaper, and so maybe there's whether we figure out a way to help someone transition where in an emergency situation they're not going to get their quick acting or their long acting, and they're going to need to just find out how to convert this to a regular insulin. So those are some of the complexities that are involved, apart from the storage, and you've got a lot more considerations. So it is something that we absolutely. You mentioned having people in your life that this is important to, and myself as well, and millions of others. And that's another one. I hate bringing up things just without a solution. When we talk about insulin, there's a couple of producers in the world. There's one factory in Denmark that makes over half of the entire world's supply of insulin. Anytime you've got that kind of consolidation with the supply chain, it should make everyone extremely nervous. And I say I hesitate to bring it up because we haven't yet got that great solution, but it is in the works, and we hope to have something here soon.
That's wonderful. Thank you so much. That one is a tough one, and we understand there's a lot of hurdles that you don't face with other medications. But
can I say something?
Yeah.
So
absolutely.
a year ago, we didn't have Jase Daily, right? And we didn't have that option. So my hope is that a year from now, maybe these guys, maybe Dr. Rowland can come up with some kind of solution.
Yeah, it sounds like they're
huge.
Sounds like they're on track. So
yeah, I think when I think that is worth maybe getting into a bit and just mentioning. It may be that maybe you don't have diabetes, and this isn't a concern for you, but maybe it's someone else in your life. But that support that we receive through these other, whether it's from the Jase case, from Jase Daily, or just telling people about this, helps get the word out, helps us to keep going further in our mission. It's one of the things that, talking about shortages, and this was in that Senate report, but they were talking about these anecdotal reports of cancer doctors having to decide whether they were going to treat a baby's neuroblastoma or an elderly person's lung cancer. They had to make these decisions because there is and has been for a long time a shortage of some of these cancer treatments, and so they're having to pick and choose. And it's easy to say maybe that doesn't affect you because you don't have cancer. No, but the point is that it could be any of these medications we talked about. They're all produced outside the United States. They're all generic medications, and just because it's cancer today doesn't mean it's not going to be your thyroid medication tomorrow. We need to spread the word. We need everyone to treat this like the really serious problem that it is, And yes, we'll all benefit. I think that will help us to continue with all these initiatives that are on the horizon, and some of them are a lot heavier lifts and involve a lot more work maybe than our Jase case, which was the first thing we came to market with. But there's some bigger things in the works.
Well, we're excited, and thank you so much for your good work and for making this available. This is solving problems that we've had concern about and our audience has had concern about for years. How do I deal with this? And there haven't been good answers, and now there are. So thank you so much. Again, we'll leave a link in the description of how you can reach out and connect with Jase Medical and solve this problem.
And if you have any problems when you're going through the little list, because it can be a little bit complicated, right? Seriously, their customer service agents, they're great. Just call them, bypass it and call and let them help you figure it out. Don't become frustrated and give up, because this is important.
It truly is.
Thank you for bringing that up. It is. It's so much more complex, and we pushed it to get it out as fast as we could. The process isn't perfect. It's getting better and better day by day. We get feedback. People who are patient with us, who will go through it with us, who will communicate with us. It was purposely done knowing, hey, we just need to get this out there. We need people to have access. Let's perfect it as we go. So thank you for bringing that up.
Now for the question of the day. What chronic medications are you dependent on, and what have you done in the past to solve that issue? Comment below. And thanks for being part of the solution.